Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and you can call us right here in the studio at 866-870-5752. Get your free book, Dr. Darrow's latest, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has over 250 studies, scientific studies, and the foreword is written by Suzanne Summers. And right now we're talking to Lonnie in Chatsworth.
Lonnie, hang with us. Nikki and Franco, hang with us here. We're going to get to you. Be patient, please. We love hearing our callers, and we love you, callers. So please give us a call, 866-870-5752. And I love talking to people about their musculoskeletal pain. I love my work. I've been doing musculoskeletal medicine using regenerative techniques, stem cells, platelets, back in the old days, prolotherapy. And I have amazing, amazing success. It has worked on me over and over and over. I inject my own body. People go, how do you inject yourself? And I go, I'm a Navy SEAL. I do what I need to do. I'm not really a Navy SEAL, but in my consciousness I am. And as I'm injecting myself, I'm just like everybody else. I go, this isn't really what I want to be doing, but I want to get better, so I'm willing to do it. So I'm going to go back to Lonnie here. Lonnie is talking about back pain and leg pain. And I didn't catch, how long has this been going on, Lonnie?
Well, it's flared up probably a week and a half ago.
Okay. And how many times has it flared up over how many years?
Well, I was diagnosed with it 2 years ago. I had a session of it then.
Okay.
And went to the doctor, and he said, I told him 3 signs, and he said, yeah, it's sciatica, just take this medication, Tylenol, whatever.
Okay.
And then I thought it was cured, because it hadn't bothered me for 2 years, and all of a sudden, like I said, a week and a half ago, it started in again.
Okay.
And I have a friend that has the same issue, and she's going to go through surgery. And I said, well, you ought to call Dr. Darrow and check it out. The stem cell therapy is supposed to help that, I think, but of course, she's loyal to her doctor, to her surgeon.
Of course,
and,
yeah.
Does that? He says he's going to put in a disc with a couple of screws. Does that sound like treatment for sciatica?
I'm not going to get in the way of some other doctor, what they want to do. I don't want other doctors getting in my face either. So that's a tough question to answer. The thing is, no matter what's going on with anybody, I can't answer the question on the radio. I have to touch the body and examine it. Okay? I don't really care what the MRI says. Your friend may have a herniated disc, may have an extruded disc that is sitting on a nerve. But I'm going to tell you something. I have seen discs that are sticking out of the vertebrae a full centimeter or more. Okay? That's big. And the person has no symptoms at all. Are you catching what I'm saying? Do you understand what I'm saying?
Yes, sir. I'm listening.
Okay, good. Because we can't. I have a photograph in every one of my exam rooms of a good friend of mine whose spine was fractured. It looks awful, even to a layman. When the patient walks in, they go, "Ooh, that's terrible. Is that person paralyzed?" And I go, "No. That person has no pain." And they say, "How can that be? Look at that x-ray." And I go, "Don't look at an x-ray. This is an example that I'm going to teach you about right now as a patient. You can't look at your x-ray or your MRI or your CT to decide if you have pain or not. Because most people who come in do have images, and those images show something terrible that they need to have surgery on. But it's not the problem. So I don't diagnose or treat based on images. Now, their images are great, if there's a fracture or something like that, and it's got to be repaired. But the general patient that I see, I'll often even send to an orthopedic surgeon if I'm worried that there can be something emergent, there's an emergency. And the orthos generally come back and say, we have to operate. And then the patient comes back to me and goes, but I don't want an operation. Can you help me? And I go, I'll do my best. And rarely do any of those my patients, get surgery. So I'm very careful to make sure that a patient really doesn't need a surgery. That's number one. And I'm not going to take a case and try to treat someone if I think there's a danger involved and surgery is needed. I'm going to ship them off to the ortho. But most of the time, they don't need the surgery. So in your case, I'm going to get back to the same question. You had this flare of low back pain 2 years ago, and it was down your leg at the same time, yes?
Yes, sir.
Okay. And then it went away after how long?
Oh, I can barely remember. I don't know, a month or so.
Okay.
But it did leave a numb spot on my ankle about 6 inches long.
Okay. So it's probably
L4
or 5.
Symptoms on Google, and it hurts the worst when I'm sitting down, and therefore I can't sit down. So I wanted to ask you if there's a stand-up support that I can use so I can work on the computer.
Oh yeah, there's all kinds of desks they make now that you can raise and lower. That's very common. And that's good for people that have back or neck pain because they get to change positions as often as they want.
Sure.
But I haven't gotten to the crux of something. I keep asking, and I didn't get the answer. So let me see if I can focus you a little bit here. Which hurts more, your back or your leg?
The leg.
Okay. That may be something then that I can't help you with, okay? If it's back related, sometimes what we get are issues of referral patterns from the ligaments in the low back down the leg, or from the neck, these referral patterns down the arms. And I have been able to heal many of those over the years. But sometimes it is what we call a radiculopathy. That means the radix, the nerve exiting the foramen in the vertebrae, is pinched. It could be pinched by arthritis, by what we call stenosis, a squeezing of the nerve, or by a herniated disc that's sticking out from the disc, some nuclear material from the middle of the disc pops out. Or it could be what we call an annular tear, where there is noxious fluid that is leaking on a nerve and irritating it. So there's a lot of possibilities, and that's why I say I have to touch you to find out what's going on. Sometimes it can just be the facets. Those are the joints between the vertebrae. Facet, F-A-C-E-T. It can be the facet joints. Yes. Facet. It can be just those joints that are arthritic that are referring pain down the legs too, or from the neck down the arms. And those can be healed too sometimes. I inject necks and backs every single day. So it's too complex for me to answer on the radio, and I wouldn't tell you anyway until I touched you and found out what is going on and moved you around. That's what's important.
Okay,
the way I
wait
practice.
For a few weeks and see what happens? Or
if it's not bothering you that much, yeah. I mean, it went away by itself the first time. And like I said, the studies show 94% of these go away by themselves. So the most important thing is don't run and jump to get a surgery, because that'll be a surgery you wish you never had.
I am absolutely against surgery, and I'm 80 years old. I don't know if that helps, but things are changing all the time.
Well, you're doing great for 80, Lonnie. God bless you.
Yeah, you sound like 50, really.
Yeah, I am. Thank you. I don't take any meds other than a thyroid, period, and that's it. I won't even take anything. I don't want to take pain pills, so.
Good for you. Good for you. Pain pills are no good for anybody.
I love what you do, and I want to recommend it to my friend, but then she'd have to come down. She's in Portland, Oregon, so she'd have to come down here, obviously, but I don't think she will. So.
Well, tell her she needs some sunshine.
I do, because it's raining like crazy out there, and it's miserable.
Of course. All right, God bless you, Lonnie. And I hope that this flare goes away immediately.
See what happens, and maybe come in and make an appointment and have you examine me. Okay?
I'd love it. Yeah,
Thanks,
the number to the office is 800-300-9300. If you want to call there right now and talk to someone, it'd be great. All right, we're going to go to Franco in a second. Franco, this is Dr. Marc Darrow. I'm going to give out the phone number to the studio so we can get some more callers before the end of the show. That's when they usually rack up, and then it's too late. So give me a buzz right now at 866-870-5752, 866-870-5752. Franco, your shoulder is bothering you. Is it your right shoulder or your left shoulder?
It's my left shoulder. I've separated it 3 times in 88, 91, and in 96.
Okay.
And I stumbled upon you by accident. I listened to Warren Eckstein, and I drive a truck.
Mm-hmm.
And I'm usually stopped right around the time your show starts, so I turn on 870 and then listen to you. So I owe. So off to work I go. I can't afford the time off or to get out there.
Right.
And it was fate. I have no doubt that you could help me. I think it was fate. I've been lamenting about calling and asking if you have any contemporaries in like Des Moines or Minneapolis. I'm right in the middle. And then today you're talking about the people you've trained, and they come from all over the country. So
I just had a woman. I just had a woman yesterday who flew in from Minneapolis. So that's serendipitous.
Sweet.
I'm going to be honest with you. There's very few people that I would recommend to do this work. I've probably done, I don't know for sure, probably the most of it of anybody on the planet. I do it all day long. I rarely take any time off.
I understand. And I don't know if you've heard the ads for podcasts, but there's one where it says a doctor in L.A. or a guy's mom burned her hand horribly, and he brought her to L.A. and did that therapy. They never mentioned any names, and it was a miracle. It burned, healed miraculously. Meanwhile, 1,500 miles away, it was a completely different story, and it sounded like he went to someone that was nowhere near your skills. But
I don't know if I'm the most skilled, but I know I do a lot. And most people that do this work don't do very much of it. Okay, even what you consider.
If I could afford it, I'd be in your office on Monday, and I'd be at Columbo's later that day.
That's funny. So what I was going to say is, people fly in from all over the world to see me, and I've had people from so many different countries. I just had a woman fly in from Dubai yesterday. Who I've worked with on and off for years, and she's had amazing results. And it's often, actually, believe it or not, it's often cheaper to fly in to see me than to see someone local, because my prices are typically lower than anybody else's in the country. I keep them low for that reason. I treat a lot of people that can't.
To look into that.
And then people
right now,
come.
You could tap me on the supraspinatus, and I'd scream in pain and drop to the floor.
Well, let's talk about your pathology for a second. You've had 3 shoulder separations. So did the clavicle actually raise up off of the acromion? Do you have a lump on your shoulder?
See it. Yeah, I do. It's higher.
Okay. And is it mobile? Does it move? Does it move up and down, or is it stable? Okay.
It's
so
pretty stable.
That area I treat all the time. That's easy to heal. That's not a big deal. I use
the shoulder area is, and I know what you say about cortisone, but about a month and a half ago, and I used to be a ortho tech and medical assistant.
Oh, great!
And I used to prep that. Yeah, I used to prep for that, and I worked for the 2 doctors up in Twin Cities that put the kids' arms back on. They did the orthopedic part, an 18-hour surgery.
Sure.
It got so bad about 2 months ago, I didn't have much choice because I have to shift with my right and I hold the wheel with my left. And I begrudgingly went in, and my doctor, D.O., gave me a cortisone, and I asked for Marcaine included.
Mm-hmm.
And it
hasn't bothered
me too much.
Franco, I don't believe in
bothers it?
Franco, you got to let me talk a little bit too, okay? I don't like that you did the cortisone. I know it feels good, but it's eating away tissue as we speak. And as an orthotech, you know that as well as I do. And for anyone listening,
well, it was years ago.
Franco, my turn.
Yeah, I mean, I had
Franco, my turn. My turn. I'm going to drop Franco right now and take this off.
Okay.
Yeah, Franco, you're a great guy, and you should be up on stage doing the show. Cortisone's not good for anybody. Let's just face it. And for those of you that don't believe me, who've had it, who said it was amazing, go look it up on Google and put in the words cortisone and put in cortisone and let's say cartilage. Use that. Put in cortisone, put in whatever you want, and see what negative effects there are. There are so many negative effects I've seen with people that I just don't like to use it at all. And it's rare I will ever use it. And the people that say it's amazing, they'll come back later and go, now that spot is worse than ever. And I had that happen to me. When I was a lawyer a long time ago, I was playing a lot of tennis, and I had a cortisone injection in my elbow. I didn't know any better. And it immediately, that day, felt amazing. So what did I do? I went back out and played tennis. And after, I don't remember how long, it was like 2 weeks, my elbow got much worse than it was before the cortisone shot. And I've told the story before on the radio. I had a woman come in that had 16 cortisone shots on her elbow. She was a tennis player. On the lateral epicondyle, she could barely lift her wrist because that tendon was worn out. It was gone. And I had to inject her over and over and over for months to rebuild that tendon. She's back playing tennis again now.
Wow.
But I didn't use cortisone. I used a regenerative medicine product to regrow the tissue. So, people always thumb their nose in my face going, I had a cortisone shot, it worked. And then a year later they come back and go, that was the worst mistake in my life. So to me, cortisone causes injuries. All right? Maybe not that day, but down the road. So something I don't like, there are times when it's a good idea to do it. Franco, if you're still listening, that shoulder separation is easy to heal. The pain in that AC joint is easy to heal using platelets or stem cells. Not a big deal. No reason to use cortisone for that at all. That makes it worse, and we'll see what happens with you. God bless you. I hope the healing stays, but most people it doesn't.
If not, book a flight.
Yeah, book a flight. You need some sunshine out here. It's a good vacation.
That's right.
So, Nita, we're going to go to Frank, who's got an ankle issue, and I'm going to give out the phone number to call me now. We've got a few minutes left. I'd love to talk to you. The phone number to the studio is 866-870-5752, 866-870-5752. So, Frank, how long has your ankle bothered you for? Hello, Frank. Can you hear me?
Yeah, there we go. I lost
Okay.
you for a minute there. Sorry about that. Anyway, yeah, doctor, I'd like to talk to you about this Hogland's, this deformity that I was diagnosed with, and see if you might be able to treat that.
What did they call it? What diagnosis did you get?
It's called Hogland's deformity.
Okay.
It's in my Achilles tendon.
Yep.
Mhm.
Go ahead. Keep talking. Frank, are you with us?
Yes.
Okay.
Hold on.
So I'm going to just take this from here. I'm going to take this from here because, Frank, you keep dropping out. The Hogland's deformity is really just a continual strain of the tissue where the Achilles tendon attaches to the heel. And it grows sometimes on people very, very large, like a big callus. If you ever had a callus on your foot, it's a similar kind of thing. It's not a big deal, and typically they're very painful because the person is either very overweight and they're putting a big strain on the Achilles tendon where it attaches to the heel. And sometimes it's from excess sports where the calf keeps contracting harshly, jumping sports and things like that. It's typically very easy to heal for the pain, but the cosmetics of it typically don't go away, meaning that lump stays there. So if it's a cosmetic thing, you may have to go to a surgeon to get rid of it. But if it's just the pain, I can handle that. We inject it with stem cells or platelets, and it really is what we call an enthesopathy, where the enthesis, or where the attachment is of that tendon to the calcaneus bone, is irritable. And by injecting it, we grow tissue around that and stabilize it, and the irritation goes away, the inflammation goes away. And it's kind of interesting because people say, well, why do you want to inflame the area with those injections? Because it's already inflamed. The inflammation that people have when they're injured is typically not high enough to bring enough fibroblasts to the area to regrow the tissue. Now, most injuries that people get go away. They heal up. But some things don't. Most heal, but a lot don't. They'll become chronic. And then we have to kick up the inflammation for a short burst of time using platelets or stem cells. And then more tissue is brought to the area, more cells are brought to the area to grow the tissue. Now, these regenerative medicine techniques not only create inflammation, but they actually stimulate new tissue to grow. That's platelets, PRP, from the blood do that. And they have a lot of growth factors. And then stem cells actually become the tissue. So we typically, if we're going to use stem cells, are going to mix it with the platelets. And bone marrow has both the platelets and the stem cells. Everyone's bones are creating bone marrow as we speak, and that bone marrow has blood and stem cells in it. And that's being released into your blood system, into your circulatory system, every minute of your life. So people say, well, why doesn't it heal? Why don't those stem cells that I'm producing heal that area that's still bothering me? Well, because it's not enough stem cells to that area. The body's trying to do it. And so what we do is we take them from the bone marrow or platelets from the blood or mix them and put it right on that spot so that there's very much of a concentration of those cells to heal it up. So yeah, Achilles tendonitis, we heal all the time. People with the Haglund's deformity, no big deal. And pretty much anywhere in the body I'll inject if it's in the musculoskeletal system to help heal it up. So Robert, you're next in line. You've been very patient. Thank you so much. Your knees are bothering you. How long has that been going on, Robert?
Robert, are you there?
Sorry, should I be turning down my volume or?
Yeah, turn your radio down so it doesn't echo.
All the way off would be best.
All the way off. Okay, can you hear me now?
Oh, yeah.
Much
Hello?
better.
How long have you... Robert, how long have you...
If I
Robert,
turn all the way down, I can't hear you.
you don't need to hear me. You can hear me through your...
Yeah. Okay, I hear you now. I'm sorry. I'm
All
trying
right.
to drive, and these people don't know what cruise control is. All right, so anyways, I'm speaking to Dr. Los Angeles, right?
Yes, sir. Robert, let me ask a favor of you. Can you please pull over to the side of the road and be safe and get off of your Bluetooth so we can hear you better?
Yeah.
You got to focus here. You're on the road.
Okay, yeah. I'm going to pull over here on Westlake Boulevard here in Westlake. Should I be on the shoulder or just?
Oh, Robert.
Robert, for you, go to the website because the show is over. Go to www.lastemcells.com and you can call me at the office, 800-300-9300. Get more information there. Watch videos on the website, www.lastemcells.com. Nita Valens, thank you so much. You're a great host. Alex, thank you so much. Suzette, God bless you all.
Thank you. See you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.